Hey everybody, my name is Michaela Abernathy, and my poster presentation is going to be on acute versus chronic biliary disease. Acute versus chronic biliary disease, we're going to narrow it down to one, and it's going to be acute versus chronic cholecystitis. An important thing to remember is acute is a condition that has developed rapidly and it is sudden in onset. Chronic is a condition that has been going on for a long, extended period of time. First, we're going to look at acute cholecystitis. Acute cholecystitis occurs suddenly and quickly, and it is the most common cause for it is gallstones. Some symptoms would be right upper quadrant pain, which is a positive Murphy sign. That would mean that while you were doing the exam, if you put your hand on their right upper quadrant and told them to breathe in deeply, then they would experience a lot of pain. If you did the same maneuver in the left upper quadrant, then there would be no discomfort. Fever is also another symptom, and leukocytosis is also another symptom. Some ultrasound findings are gallbladder wall measuring greater than 3 millimeters, gallstones, increased color Doppler flow, and a stone may be in the Hartmann's pouch or the cystic duct, blocking the bile from getting out of the gallbladder, which is what causes acute cholecystitis. Some clinical findings may be an increased serum amylase and also an abnormal liver function test. Some complications may be emphysematous cholecystitis, gangrenous cholecystitis, and acalculous cholecystitis. And then here's a picture of acute cholecystitis, and it just looks like a sick gallbladder. Sometimes there can be stones also in the sonographic image, and then you would have to, when that happened, then you would have to record that also. So then we're going to go over and do chronic cholecystitis. Some symptoms of chronic cholecystitis is transient pain in the right upper quadrant. What that means is the pain comes and goes just depending on, and then you have to remember that chronic cholecystitis is when this has been going on for a long period of time. Also, some of the symptoms may be similar to acute cholecystitis, because what chronic cholecystitis is repeated attacks of acute cholecystitis. So it's just been going on for a long period of time, while acute cholecystitis is just the sudden onset. Some ultrasound findings you may find would be gallstones, wall thickening, and a West sign, which is a wall echo shadow. What that usually means is there will be a bright gallbladder, but there will also be, it looks like there's a bunch of gallstones and there's a lot of posterior shadowing because it's like a packed bag of gallstones. Here's a picture of it. It's not as big as that one, but you can see that it's just black right there from the posterior shadowing of all the gallstones there. Some clinical findings would be an increased serum amylase, and then abnormal liver function test. That's kind of the same thing as acute cholecystitis as well, but also with the chronic cholecystitis, there will be transient right upper quadrant pain, which just means it comes and goes. There will not be a positive Murphy sign in chronic cholecystitis because it's been going on for so long and the pain just comes and goes, but there will not be a positive Murphy sign. There's the picture of it, and then I have another picture here that shows acute and chronic cholecystitis. Acute cholecystitis, that's when it shows here that it may be blocking the bile exiting or entering the gallbladder, and then there's a few stones in there that you can see, and the walls thickened. With chronic cholecystitis, here it shows the packed gallstones, and there will be a lot of posterior shadowing like the image up here. Some facts, risk factors for gallstones, which is what mainly causes acute cholecystitis and chronic cholecystitis, or that's one of the forms that causes it. Gallstones, and it's down here, being female, pregnancy can cause gallstones, older age, and also obesity. And then also, if you look at this picture, then the gallbladder wall is also thickened on the chronic cholecystitis as well, and it's going to be greater than 3 millimeters.